Okay, so what is COVID-19? Coronavirus disease (COVID-19) is an infectious disease caused by a newly discovered coronavirus. Most people infected with the COVID-19 will experience mild to moderate respiratory illness and recover without requiring special treatment. Older people, and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness. It's a good thing that most of the patients recover from the illness without any treatment. According to research studies done so far, older individuals, especially with underlying medical conditions like cancer, respiratory disease and diabetes, are more likely to suffer from severe symptoms. So, what are the preventive measures then? Fortunately, there are some proven ways to prevent infection and slow down the pace it spreads at. We will be focusing on some of the tips that can help you save yourself from the infection and slow down the spread. Make it a habit to wash your hands with soapy water. It's better to wash your hands for at least 20 seconds, as this is the amount of time the soapy water takes to kill the virus. If someone is sneezing or coughing, make sure you stand at least 1 meter away from them. We tend to touch our faces frequently and unconsciously. As our hands might contain millions of dangerous microorganisms, we must avoid touching our face with the hands in order to prevent from COVID-19. If you have to sneeze or cough, cover your nose and mouth to keep the droplets from infecting others or things in front of you. If you think that you are infected with the virus, don't get out and stay inside your room. It is strictly essential to limit your contacts with other people outside your family to prevent the further spreading of the virus. Don't smoke or take part in activities that can cause your lungs to get weaker. In case of infection, smoking increases the chances of having more severe symptoms, and it becomes more difficult for the patient to recover from the disease. Practice social distancing and don't travel unless you really have to. We can always get back to our normal lifestyle once the outbreak has been contained. So, we should strictly maintain social distancing and limit ourselves from other people until the outbreak has been contained and resolved totally. So, what are the symptoms of COVID-19 then? First of all, it's important to note that the coronavirus doesn't affect everyone the same way. Most people suffer from mild to moderate symptoms. This means most of sufferers can recover from the illness without getting any special treatment. All they need to do is keep themselves away from everyone and practice the tips we discussed earlier in the video. However, people with underlying conditions are at a higher risk of suffering from severe symptoms. Some of them may even die from the virus. Similarly, people over the age of 60 are also at a higher risk of severe symptoms. Therefore, these people should be more careful than others. The common symptoms are dry cough, tiredness and fever. They are mild symptoms and can go away between 7 and 14 days. Other symptoms may include sore throat and shortness of breath. Few people may suffer from a runny nose and diarrhea as well. If you have mild symptoms or you are observing self-isolation, you may get in touch with your healthcare provider for advice on how you can get tested for the virus. This is important if you want to save yourself and your family from the infection. Your life and the life of your family are in your hands. Thank you for watching. If you would like to see more interesting contents, please like the video and subscribe our channel.